Thank you for being here and for tuning in for our update. Throughout this process, we have had the luxury of living in a community that has robust medical infrastructure. And part of the planning and the preparation and the decision making that we did was in consultation with our hospitals, and we're very, very thankful for that. We've worked as a team here in Central New York throughout this process, and to give us an update on where one of our hospitals stands today, we have the CEO, President of St. Joe's here with us, Dr. Leslie Luke. Doctor, come on up.
Well, thank you very much. I'm really happy to be here to talk a little bit about what St. Joseph's has been doing. Since the beginning of this crisis, there's been a lot of planning and execution in which we were able to put together a really good process to take care of the potential COVID patients, as well as to plan for the surge. As it stands today, for us, the data that we have, it appears that we have passed the peak. On average, we're having maybe about 1.5 admissions per day. We're anticipating over time that's going to decrease. Our total capacity normally is 451 beds. On average, we've been having about 240 patients in-house during this period of time, so we have good capacity right now. If for some reason there was a significant surge, we would be able to go up to about 700 beds without much difficulty because of the way our facility was constructed, which enables us to change many of our private rooms to semi-private rooms. We also have more than adequate ventilators right now. We feel fortunate because we are able to set up special units to be able to help our COVID-19 patients. We have what's called negative pressure units, and thus far, we've been able to treat all of them very well. Currently, we have 18 COVID-19 patients in-house, and the number of patients on ventilators has been steadily decreasing. So we believe that from this point onward, we'll be able to continue to take care of our COVID-19 patients and contribute to our community. And very grateful that we've been able to coordinate well with Upstate, Crouse, the county, and the city, and many other community organizations. Yeah.
I want to thank Les and his team for all their great work. We are very, very lucky to have the partners we have in our community to really take this fight to the virus and this pandemic. Let's get into some data, and then we'll hit on a couple points, and then we can take some questions. We know that each day comes with bits of progress, but each day we have the reality that this virus is a killer. And today we've lost 2 neighbors to this virus. We now have lost 21 neighbors in the last really 5 or 6 weeks to this virus. Both these individuals are females. One was in their 80s, the other in their 70s. Both had underlying health issues. One was a Caucasian woman, and the other was a woman of another race. What's really hard about this is that when we lose neighbors, it's the reality that family members can't be with them and really go through that process. And many family members don't get to say goodbye. And so we recognize that we grieve with you as a community. We're very, very sorry for your losses to everyone who's been tragically impacted by death in this process. When we look at current cases, we now have 646 current cases in Onondaga County. This is up from 637 yesterday, so we have 9 new cases. We have 42 individuals in the hospital. This is representing 16% of our active cases. This number's been trickling down a little bit. What it looks like, and I think we just heard that from Dr. Luke, is that the hospitalizations look to seem like they've peaked. And now we're stabilized and on a slow but downward trajectory. We have 18 individuals who are in critical condition still. This represents 7% of our active cases. Out of these 18 individuals, we define critical as being somebody who's in an ICU room, somebody essentially who needs help to breathe. Certainly not a position you want to be in. Further details on those who are hospitalized: 21 Caucasian, 12 African American, 4 of another race, and 5 unknown. We just don't have the demographic data on them at this point. Today we've had 362 people who have recovered. That is our green curve down to the bottom here. That is up 11 folks that have recovered. We're very thankful for that. This is a very good number. We always talked about our green curve needs to continue to go north. Our yellow curve needs to flatten and start going south. And our red curve needs to start to flatten. Certainly the data over the last 48 hours is suggesting we're making some progress in that. We now have 263 active cases. That's down 4 cases from yesterday. Again, this is good, positive news. And we have 82 individuals out of our positive cases that are contact cases. So contact cases are individuals where you have a positive case in the household. There's a higher percentage at that point that somebody in the household is going to be a contact and test positive with COVID-19. 82 out of our 646 individuals are not essentially new cases, they're contacts of existing cases. We now have 914 people in our community in isolation and quarantine. That is down from 94 individuals from yesterday. So we had a lot of people out of quarantine in that number. We had recoveries as well. But certainly I want to thank all of those in the community who've been in quarantine, who've worked with our health department through this process. Certainly want to thank our health department for doing just a fantastic job as well. This is also good. These numbers are solid. When we look at who our cases have been and who they are, 354 female, 292 male. We have 20 individuals who have been under the age of 19, 125 in their 20s, 93 in their 30s, 107 in their 40s, 118 in their 50s, 89 in their 60s, 49 in their 70s, 32 in their 80s, and 13 in their 90s. Percentage of breakdown, 22% of our cases have been under 30, 37% have been under 40, 53% have been under 50, 72% have been under 60, and 28% of our cases have been over 60 years of age. Breakdown by municipality: City of Syracuse, 274 cases, Town of Clay, 70, Town of Manlius, 45, Town of Salina, 37, Town of DeWitt, 36, Town of Camillus, 33, Town of Onondaga, 30, Town of Cicero, 26, excuse me, Town of Geddes, 21, Town of Pompey, 20, Town of Lysander, 18, Town of Skaneateles, 13, Town of Marcellus, 4, Town of Atisco, 4, Town of Van Buren, 4, Town of Lafayette, 3, Town of Elbridge, 2, Town of Fabius, 2, Town of Spafford, 2, and Town of Tully, 2. This is representative of all of our 19 towns in the city of Syracuse. We've had cases. The virus is certainly east, west, north, south. It's been everywhere in our community. We've had people ask us for active cases related to recoveries now by town. So we try to put together the data in the timing we can. So we will work on a town and city recovery data point at some point as well, recognizing that we have community spread with this virus. And if your town has less cases because you've had more recoveries, that doesn't mean that you can't get the virus. We're very connected to each other, to other communities as well. Testing, let's go through this. We've had over 8,407 tests administered. We've had 8,286 tests that have been returned, with 646 positive results and 7,640 negative results. That is 7,640 people who were sick. They were just sick with something different than COVID-19. We have 121 pending tests, and we received 160 tests back since yesterday. 7.8% of those tested at this point have tested positive. What's important now is we're in a process, and we'll go through this in a second. We've been touching on this, but we have roughly 460,000 people in our community. So when you look at our number of tests that we have, we're approaching testing 2% of our community. That's actually a pretty good number when you compare it to other communities throughout the state and the country. So we've done robust testing. When you have partners like we do with St. Joe's and Upstate and Crouse and the Syracuse Community Health Center, now we have the Walmart location. That gives us an advantage to test people who are sick that share symptoms of COVID-19 and enables our health department to do their investigations. We are now in a full-blown proactive testing mode, testing nursing home personnel at the Walmart site in East Syracuse. We are now testing assisted living facilities and independent living facilities right now with our partners at the Syracuse Community Health Center and the Nescentia Health, which is going into some of the assisted living facilities and testing the residents. This is proactive. We're going into parts of the community where there's higher density in buildings and where right now phase one is where we have seen at least one positive case of COVID. Once we go in there, we're trying to hunt down the virus in those facilities, see if it's still a threat, then we move on to the next facility. So some of these tests, the pending test number may be going up over the next few days. That's because we're implementing this new strategy and we're playing offense with this virus. Looking forward to the results after a positive test. Again, we talk about this every day, but if you're certainly new to the briefing, we want to do that. If you test positive, you'll hear from your doctor. If you don't have one, you'll hear from our health department, and you'll hear from our health department regardless if you have a doctor. So you automatically hear from our health department. We will check in on your symptoms, see how you're doing, how you're feeling. In addition to that, that's when we start our investigation into contacts, who you've been in contact with, not just since you've been symptomatic, but probably most likely a day or two before that. At that point, we reach out to your direct contacts, and those direct contacts will be put into a quarantine. If you work at the same employer as an individual, that does not mean you had direct contact with that individual, and so that does not mean you'll be in a quarantine. You will hear from us, the Onondaga County Health Department, if you need to be in a quarantine. Important to remember that. We've talked a lot about social distancing. There's a lot of conversations about this. The reason our data is moving in the right direction is because of you. It's because of you buying into this and you helping us starve this virus and give our health department and our medical professionals more time to treat the sick so they get better and get people out of quarantine. That helps preserve the medical infrastructure in our community. So I want to thank everybody for all their efforts related to this. We've been doing great. We need to continue to do great. We need to continue to stay away from each other, wear our masks when we're out in public, 6 feet from each other. The virus has a very hard time living past 6 feet. So the data is getting better. We need to hunker down. Now, there's a lot of different talk about social distancing orders, and let me just reiterate this. Before this week, in New York State, the order was April 29th, and from the federal government, it was April 30th. So you have the president and the governor who both agreed on a date, essentially, for social distancing policies. So it's April 20th. It's 4/20 today, so it's April 20th. So regardless of what the updated New York pause date looks like, we knew we weren't going to be starting anything today anyways. So my point being this. We've talked about social distancing. And we knew that we had to get through April 30th. We had to hunker down and get through this to continue to drive good data. That's what we're doing as a community. We've also talked about how potentially in our state, even though the governor has pushed back the New York pause to May 15th now, that regions could potentially have a restart earlier if, and only if the healthcare data merits that. So what are we doing now as Onondaga County? We're doing the same thing we were doing in February, preparing for this virus. We are planning and preparing with our partners in our Central New York counties about what a restart looks like, how we phase in a restart into our region and our regional economies. We're starting that. We're doing that right now. And then once that plan is done and ready, we'll go to the state and discuss that plan. And the question is, when do you implement that plan? We'll implement it when the healthcare professionals deem that they can respond to this virus in real time. So from the standpoint of folks who are getting very anxious about the economic ruin that many organizations and families are potentially facing, including our county government, I get it. And we're starting that planning process. But don't focus in on what the new dates are. Let's focus in on the fact that we knew we had to get through April anyways. So let's get through April, let our teams do our planning work, and we're going to continue to look at the health data. If we social distance, we'll continue to see that data improve, and we'll have a stronger case to reopen the economy. Speaking of job openings, please go to www.ongoved.com. Again, that's www.ongoved.com. To our economic development page, we have a list of multiple companies that are hiring in multiple economic sectors. So please go there. If you're out of work, you've had hours cut, please look at this as a resource and look out. There are companies that are hiring and companies that are doing quite well with changing consumer patterns. Let's see here. Go over a couple lines, and then we can take some questions. Certainly, our Upstate Triage hotline, 315-464-3979. If you need to get testing and you don't have a doctor, we don't want you just showing up at emergency rooms. Call this hotline. You then get screened. You go to the triage testing site at Syracuse Community Health Center. Our seniors, healthcare worker, and adult nutrition hotline, 315-218-1987. This is a hotline for folks who need help. They've never needed this type of help before. You need a meal, you call, we'll get you a meal. You need some groceries, you call, we'll work to get you some groceries, toiletries, etc. If you're a healthcare worker and you're working different odd shifts, you go to the grocery store, you couldn't get certain products, we've filled that gap as well. So please call that. One of the challenges we had when we had to enter this phase to fight this pandemic was childcare. We worked with our childcare partners at Childcare Solutions and came up with a childcare plan for all essential deemed businesses, their employees. So 315-446-1220. If you are deemed essential, you qualify for a childcare slot in this program, and we have hundreds of slots available. And that will continue to be something that's part of this process moving forward as well, making sure that as people start to go back to work, their children are taken care of. Certainly, we talked about the emotional and mental health toll this has taken on all of us. Certainly, I am not excluded from that category. 211. Call 211. Get the social and emotional support you need. They can help make referrals. They can help give strategies to deal with these unprecedented challenges. Again, I want to give a big shout out to our parents. When you look at our cases under 19 years of age, you're doing fantastic by helping keep your kids safe, by keeping them home. So as hard as that is, and I know it's hard, you are doing a great job. So thank you. Vera House support and information line, 315-468-3260. There's never any excuse for abuse. If you're in a position or a situation where you're uncomfortable, you need help, contact Vera House. Again, 315-468-3260. Our New York State Children Abuse Hotline, 800-342-3720. Again, this is a situation where right now many of our mandatory reporters are teachers. And they're not with the kids every day. We're concerned about this. If you know something's happening in a household, please contact the Child Abuse Hotline, contact the McMahon Child Advocacy site. We need you to take care of our young people with us. Again, donations of PPE. Certainly St. Joe's knows how important this is. PPE is the protective equipment that our medical professionals need, especially in our COVID units. These are the masks, these are the gloves, these are the gowns, the face shields. If you have anything hanging around, we get them out to nursing homes, we get them out to first responders, we get them to the hospitals. Please call us 315-435-2525. Okay. What questions do individuals have?
I have a question for Dr. Luke, if he doesn't mind coming back up.
Doctor, do you mind coming on up?
You mentioned from what you're seeing at St. Joe's that we are past the peak, and you have a lot of bed capacity. Is it time to relax the restrictions on hospitals and start, are you in a position to restart elective surgeries?
Yes, we definitely are ready to restart elective surgeries as soon as we're allowed to. We have more than sufficient staff as well as equipment and supplies to do that.
You have the PPE.
PPE, we are still needing more. We have enough, to treat the volume of patients that we currently have, but we definitely would be a lot more comfortable if we could get more N95 masks, et cetera.
Mostly masks?
Yes, mainly masks. One thing that the county executive did ask me to talk about, which I failed to do so, was our testing capacity. So we are able to run those tests and get the results within 2 hours. So the patients now, if they come through our emergency department, we're able to test them there and either discharge them or admit them. Whereas before we had that capacity, we would have to admit the patient and wait for several days before we actually got those results. So.
How many, is that something that's open generally, or do you do that just with incoming patients, or who is that testing available?
We test patients who have symptoms just to confirm that they actually have COVID-19. Right?
How many folks do you test a day?
I don't know that number. Sorry.
Okay. But you're ready. If the governor says go, you would like to restart elective surgery.
Very much so, because what's elective today is not elective tomorrow, depending on one's disease state. And so that's something that is really important. We've got community members out there who have needed surgery for some time, some of them scheduling the elective surgery months in advance, and then we had to cancel them. And so they've had to wait longer. And some of these community members are in pain, or by waiting, their disease state actually advances further. And so delay actually causes more problems in the end. So we definitely want to get back to that as soon as we can.
Thanks.
Okay. And for clarification, I'm not a doctor. My dad was a doctor, but I'm not a doctor. Okay. All right. Thank you.
Before you go, just have one question for you. Are there any St. Joe's ICU or different nurses that have gone downstate? We've talked about upstate before. Are there any teams that have gone to help in the more, kind of really concentrated areas where this is happening?
Currently, I believe there have been some, but they've been doing that on an individual basis. We have been in discussions with downstate hospitals and trying to coordinate that now and into the future. We've also been in contact with the governor's office, who's doing a lot of this coordination. So there's definitely a willingness to do that. We just need to pretty much be matched up with another hospital and then end up working with them directly to do that. Now, one advantage also of being part of Trinity Health is we have got quite a number of hospitals across the United States. So we've been able to deploy about 100 other personnel to some of our other ministries across the U.S. Is that it? Thank you.
Ryan, I see a bunch of counties here in the regional status chart. Are those the same counties in which you're partnering with their leadership for the restart plan?
Yeah, so part of what we're doing with this chart here is we're looking at our positive cases by region. You can see the curve going up a little bit, but certainly looks like it's flattening out. Then when we look at the green is our active recoveries. Again, our recoveries are going in the right direction. And this is our active cases. So these are the active cases now that our health departments throughout all the counties, which are Cortland, Cayuga, Madison, Oswego, ours, Oneida, and Herkimer are currently managing. So we've talked about this as a region, what triggers a restart. This data is what would trigger a restart if the governor agreed with our plan. And so we want to start looking at this data on a daily basis like we look at our own, because certainly there will be no restart for the one county by county. There's 57 of us. So we think this helps show that we're getting closer. And what's also important is many of these counties implemented the same social distancing guidelines that Onondaga did, and they're starting to see the same impact with their numbers as well.
What does a restart look like to you?
Well, a restart is a phased-in approach of bringing different business activities online that can follow social distancing guidelines that can be regulated. And part of that certainly is our health department has to be ready to, with a COVID tracking team, a new team of professionals that go and track this virus on a daily basis through primary care networks, through hospitals, through nursing homes. So you need all of these pieces. And we heard Les talk about elective surgeries. I've been talking about elective surgeries for over a week now and how we're ready. Let's get those going. That's not a restart. Hospitals are essential businesses today. That's loosening up a regulation. There's other regulations that can be loosened up and that won't on existing businesses that are already operating. But what we're talking about is new businesses coming into the marketplace. We're talking about them being able to operate and social distance at the same time, potentially scheduling in appointments, not allowing density in waiting rooms or whatnot. And we're certainly, part of that is the data needs to merit and your health departments need to be able to actively track it in real time. What Les talked about with his ability at his hospital to give a test result in hours is critical to that. We can go, we think we have a case, they go to St. Joe's, within 2 hours we know if that's a positive, okay? And if it's positive, that means we are already starting our investigation into quarantines. That's in real time. That needs to be part of a restart. And we think essentially that part of it, we're there. We're in real time right now tracking our cases. We have more capacity with more test kits. Our partners have better capacity with testing technology now than we did at the beginning of this process.
I realize that chart is just one tool you have, but is there a chance some of the other counties' data is skewed toward the positive because their testing capacity wasn't what Onondaga County had? Yeah,
I guess you could make that argument, Andrew. Everything is somewhat relative. I'm not sure all the testing that was done in some of these counties. We're the largest by far. We're double our next closest county as far as population goes. We've done almost 2% of our population. By the time we're done with our proactive testing we're doing right now, we'll have 3% of our population tested. So I think it's representative of the region when you look at all the numbers compared to other parts of the state. And why are we doing better in Central too? Just besides having the robust infrastructure and the planning and preparation, going into mitigation strategies before we had positive cases, we're in the middle of the state, okay? So that's a benefit to us. We're certainly hours away from New York City and a quick plane ride, but when you look at the regular driving patterns, we're 2 hours away from one population center in Buffalo, and they have a border with Canada. We're 3 hours from New York City. We're kind of protected in the middle of the state too. Our geography has helped us within this process.
When you talk about a COVID tracking team, how does that compare with the roughly 25 people the county health department has had up until now? What numbers are we talking?
We're going to have more people. So part of that is a lot of those people in the health department now used to do food inspections and used to do different things in our health department. Now they're on that team. So what a COVID tracking team, and again, this goes to fighting this virus. There's a lot of conversations out about, we've talked about our economic situation as far as revenue. Our sales tax is just getting absolutely dismantled on a day in, day out basis because everything's shut down. But we have more expenses to fight this virus and to live with this virus. So part of that is we need a team of individuals whose job it is to essentially work on an hourly to every 2 hours basis with all of our health network to try to track individuals that are showing symptoms of this and to get out in front of it. So we're going to talk more about what that looks like, certainly as we put together our plan, but it will be more healthcare professionals and investigators on this team.
And who's going to pay for it?
We are, Onondaga County.
Oh, you have any rough guesstimate as to how many bodies that is?
Not yet. I'm waiting for that plan. So Dr. Gupta is working on that.
What's the status of the meeting time, meeting date for this group of county executives and legislative leaders to talk about the restart plan?
Yeah, we had conversations today. We have more conversations tomorrow, and we'll have more conversations later in the week as well. So a lot of work being done behind the scenes.
It seems like there's two strategies. One is loosening restrictions on the essential businesses that are already open, and the other one is looking at the non-essential businesses and see how you can phase those back in.
Yeah.
Do you have like any more details on where you see that?
We're not going to go and talk about a restart plan until we've had a chance to review it with the state as far as specifics. But we believe a restart is bringing more businesses online that now are going to be regulated related to social distancing. And that's part of this, is part of our tracking team or new functions of our health department will be, we are going to regulate this with businesses. It's easier to regulate social distancing and wearing masks with businesses than it is with individuals on the street. So there will be regulatory enforcement unit as part of all of this. But when it comes to loosening up regulations, I think there's certain things that you can do and do safely that you can loosen up today. Elective surgeries being one. Why is that important? It's a public health concern too, as you heard Les talk about it. Also, that helps get some of these workers who have been furloughed back into working. And these are healthcare professionals. These are people who are trained, and St. Joe's has an infectious disease control platform, just like our other hospitals. There's no better place to bring in some more density than in healthcare. Same goes for eye doctors, dentists. These are all things that we can loosen up regulations to help get people who are in the healthcare world back working and help get people who need help.
The business enforcement unit, that would be a function of the health department too, kind of a la restaurant inspections?
Yep. Think of food inspectors. And certainly, and we're hearing from business right now who want to get going. And they're saying, regulate us. Let us get going. Regulate us. We'll do what you're asking us to do. We know what we need to do. So I don't think that will be an issue, but that will be part of the process.
Are you going to hire people?
We're going to have to hire people in this regard. We have a hiring freeze everywhere else in county government. We have a retirement incentive that's passed. We're forced with multi-million-dollar deficits because of revenue shortfalls, but we still have to do this in order to be able to restart the economy at some point. You can't have it without it.
Ryan, tonight on the news at 6 o'clock, I'm running an interview I did with a woman whose dad is at Bishop Rehabilitation on James Street in Syracuse. She's trying to ask them how many, her dad is a COVID positive patient. She's trying to find out how many people in that facility have COVID-19. The county refers me to the state refers me to the facility won't tell me. Is it acceptable that this woman can't get that answer?
I don't want to say if it's acceptable or not, but let's go through what the question was. We, the county, don't regulate nursing homes. I have put forward a plan to help mitigate what this woman and her family are dealing with by testing the employees, figure out who's asymptomatic, because if you're asymptomatic, you can potentially spread this. The state has put regulatory guidelines on the owners now to reach out to families. So your question is, does the regulation say to the family, now you own the nursing home, how many people, they have to tell you whether you're positive or not, right? Do they have to tell you how many people? I don't know the answer to that question. I know I don't have that regulatory authority. I know nursing homes in general have been a challenge and have been a problem throughout New York State. We share the concerns, and we're doing everything we can proactively and are offering our resources to the state to help complement or supplement their efforts. I think the state is actively working on this in Central New York right now. So I think for families who are trying to figure out how many other people in the unit in their nursing home have it, I understand their concerns. I don't know the answer to that.
Does the county health department, though, have the data? When you get this list of positive cases back from all these testing sites or from the state health department, does it break it down for you if it's in nursing homes?
I have not seen data based off of addresses. I'm not shared with that data. So hypothetically, we may see this many people and they have that address, but that gets into the HIPAA space where you can start to figure out who's who, and neighbors can try to figure out who might have COVID, who might not, and that gets to be a HIPAA issue. But there's nursing homes that have had more than one case. You know, some of them have had none. Some of them have had more than one. It's a problem when you have density, and any building. We've seen that in affiliated cases in other buildings that have density.
Why do you think the state is hesitant to release that number per facility? It's public money in a lot of cases. It's people's families.
You would have to ask them. I'm not sure if it's just a resources issue at this time or what it is. I know we get asked a lot of things. We get asked for a lot of information. You're talking to a team of people that is at 25% of our normal staffing levels. So I'm assuming the state of New York's at the same levels. But you would have to ask them. We are as transparent as we can be with our information when we get it through. I don't know how many people have COVID-19 at Bishop's. If I knew the answer right now, I would probably just tell you right now, and that would be the end of it. So I don't have that information.
On testing nursing home employees, senior living facilities, you said you've gotten one positive case and that just started on Friday. Do you expect to see more, and how concerned are you about that?
What was the beginning? One positive case?
You said that in the proactive testing that you've been doing,
Yeah,
began on Friday,
it did.
and you said since then you saw one positive.
No. What we're picking the buildings where we've had positive cases. So I don't know if we've had a positive yet from that, but where we're going is we're going into for assisted living and independent living facilities. We are targeting buildings or communities that have had positive cases, and that's where we're going first. And then we're doing the other assisted and independents. Nursing home employees are being targeted for testing at every facility via the Walmart site.
The date on your voluntary shelter-in-place posters is April 21st, the end date. That's tomorrow.
Yeah.
Do you expect to extend it?
We'll see. We'll see. I think I still got another day to mull it over. I think overall, Channel 9 is really good at this question. I think overall what we've seen is the community's rallied around an effort. We had April 30th was the date, the president. April 29th was the original date, the governor. We came out with ours to rally our data. Everybody says we're not the same as New York City and Long Island. Okay, let's prove it then. Let's prove it with our own data. Let's make that case. So I think everybody's done well and done that. For us, it's not, we gave out some guidance. I believe that people have taken that seriously, and people should continue to do that. Everybody should be trying to do 50% less than they were doing the week before.
I asked the question because people will wake up tomorrow wondering if it's their last day. So you have the day to decide, sure, but
yeah.
people want to wake up knowing if it's the last day.
I think social distancing should be what we're following, whether or not we say our voluntary shelter-in-place order stands for another 8 days or not. I don't know what we're going to do with that, Andrew. I just think it's smart. People know this by now, that social distancing is what we need to do. Every doctor says it, not every politician. Every politician is pretty much saying it. But every doctor says that's what you need to do. And so let's do it. It's worked. It's worked here. It's worked here. We were testing in the beginning of this process, 450 people, 400 people, 375 a day. Since we started doing this, that demand's been cut in half, and our positives are starting to get under control. Many of our positives from the last 2 weeks were affiliations, meaning we get the affiliations under control. That data looks even a little bit better. So it's working. We said when we start this, we'll see the results in 10 to 2 weeks. We're 13 cases yesterday, 9 today. Those are nice numbers. Our health department can work in real time with those numbers. 30 cases, 40 cases, 50 cases a day. It's harder to work in real time with those numbers. So because of the efforts and the social distancing, we're getting to a point where we can actually start to say maybe we are a little bit different from New York City and from Long Island, and when any metric you look at, and we're starting to make that case. So let's keep it up. We know April 30th was the President of the United States Day. Let's get through April 30th, and let's see where the data looks like.
The state health department started antibody testing. Will that play into the analysis at all as to a restart?
I think we're interested to see where the state's going with this. They were here yesterday. I don't think they're here today. I haven't been told if they are or not. And they were doing a random statistical analysis throughout the state. And it would be interesting to see where they're going with this. Again, I don't think making testing the number one green light or red light related to a restart, I think is problematic because you have testing constraints to a degree. You can't test everyone. But also from an antibody test, if you were to say that this employee can go back to work, well, if the right employees can't work, you can't operate the business. So if the right employee, so that doesn't necessarily work. So I'm interested to see where the state's going. It shows a level of immunity. It's kind of a great research tool about how to potentially fight this moving forward with strategies. But I'm really curious to see where they're going. But certainly we'll cooperate any way we can. If some of our partners get antibody testing and they want to start doing that, we'll ask them to work with us. So we're sharing that data and we're learning as well. And the more you learn, the more you can apply new strategies now and moving forward.
And with your more, I think you described it as a more proactive testing stance now, and if the numbers are what you suggest, you're going to test a lot more people.
Yep.
And probably get more positives as a result. How's that going to factor into your analysis as to where we are with research?
Yeah, I think when you do proactive or strategic testing, you look at those as affiliations, and you're trying to find what the intensity of the community spread is. Affiliations, especially in a building, aren't necessarily representative of community spread. And so you go in, you quickly identify, you isolate, you quarantine. Hypothetically, in 2 weeks, your problem's taken care of. So I think right now we know by going after and looking for these affiliations that are impacting our most vulnerable, which are seniors, many with underlying conditions, we're going to save lives, A, and B, we're kind of taking the fight to COVID. We're hunting down potential cases that we don't know about right now. So I think overall, it may, to your point, it may make our active case in our county flatten a little bit. It's going down. It may make it flatten a little bit, but that's a strategical play on our hands to try to save lives. And certainly, I think all this, when you're looking at data points for a restart, is going to be what your health department can do to make sure that they can perform their jobs in real time. And right now, we're getting close.
I know you don't want to give away your sources, but there's areas where they struggle to get tests and there's really strict restrictions on who can get tested. How are you able to do proactive testing when other places can't even test sick people?
Trish, you know the answer to that. We're special in Onondaga County. So I think, we're doing testing at our triage site for all of our Central New York partners, Northern New York partners, Western New York's come up, Capital's come up. We've tested people in Westchester, the Bronx, Staten Island, Nassau County. So we're there. We are very lucky. We have 3 very large hospitals with a very large network of primary care providers. So when it comes to testing, we're procuring test kits and trying to procure them, working with the state. St. Joseph's, Upstate is, Crouse is, Syracuse Community Health Center is. You have other labs like Quest who've partnered with Walmart, who've done work and at the Community Health Center as well. So when you look at all these different people in this space, you build up capacity. And so if you're a rural community and you don't have a hospital and you have a small community health center, that's probably their only way to get testing. And we recognize that. That's why when I don't even know if it's still up anymore, one of our early maps were how we're leading the response for all Central and Northern New York. And we color-coded where people live and when they've come for testing. That's why we've never turned anybody away. And so we're lucky. It's not just the county's capacity for testing, it's all of our partners built in. We're all one team, and that brings up really strong testing capacities right now.
Can you talk about the James Street Wegmans being chosen as one of the places for this antibody testing that the governor announced yesterday? What does that look like? And what's the process? What do you know about it?
Yeah, my understanding was, and I don't know if they're there today anymore. I knew they were there yesterday, and my understanding was they didn't want people knowing about it because that would create people wanting to go to get testing, and they wanted to be completely random sampling. But it was a voluntary antibody test. I think it was like a finger prick, and hopefully they'll share that data with us and really help us bring us into the big picture is what they're trying to accomplish. I know that they're very interested in antibody testing statewide, and that could be, if you have the ability to do it all quickly, that would be a good tool to bring into a restart. The challenge is right now it's not going to be done in 2 weeks for the whole state or 3 weeks to figure out who can work and who can't work. So it's really a good tool. Technology is evolving with testing. Who would have thought we'd be talking about social distancing companies, test kits for COVID-19, all these things in early February, but here we are.
Do you know why they chose Wegmans? Why that's a good spot?
There's
for
2
some people?
locations they picked. There was a Price Chopper as well, I think, on Erie Boulevard. I think they picked 2 high-traffic areas where they could get demographic diversity, and that was probably, if you look at like I would compare it to something I know well, political polling, right? You want to get a good sample so it's statistically accurate with the data you're getting. And so I believe that's why, A, they had to be in Central New York to do it. In our county, we're the population center, but B, they wanted to be in locations where they could probably get the diversity that they're looking for.
Ryan, a couple times now this afternoon you've said, let's get through April. And I'm not trying to put more words in your mouth than you want to put, but is that basically your message to folks who are just angry or upset or anxious about a restart, is let's think about possibly early May?
Yeah, I think my message is nothing's really changed as far as what the plan was. The change is on May 1st. If there's nothing, hypothetically, all the governor did is say April 29th isn't the date anymore, May 15th is. It's April 20th. So nothing changes for the next 9 days. The president said April 30th, so the next 10 days. So let's not get angry about this right now and get worked up. This was the plan. We're still in the same initial time period of the plan. A lot of people don't like the plan. A lot of people think the plan's overreacting. The healthcare data has been better than everybody thought. Everybody recognizes that. But that doesn't mean we can meet the day-to-day needs of fighting this virus in real time yet, when when we've basically starved it so that we're getting the data. And now if you bring everybody back together again too quickly, you could be in a situation where it comes back and the curve is much larger. The toll on public health is much worse. It will be very hard to get people to listen to social distancing again, and that will then lead to more death. And so my point is, we knew that April 30th, nothing was happening before that. It's only April 20th. So let's take advantage of the next 10 days. Let's take advantage of it to continue to social distance, to continue to drive our data here in Central New York, not just Onondaga County, but all Central New York. So our data is so strong, there are limited new cases. Give our health departments more time and our hospitals more time to get people better. So our active case curve is going down, our positives going up, and our other curve flattens. Then, by that date, we will have shown the state of New York a restart plan. And by that date, if the medical data shows it, I'm sure the state of New York will reconsider their approach for Central New York. But let's not overreact right now. I see protests, I get it. People are concerned about their liberty, they're concerned about economic ruin, I get it. I feel it. People also are concerned that everything's going too fast. We got to find that balance. We start to find that balance on April 30th based off of our healthcare data. And if we have a good case to make, we go to the state. This is our case. We're ready to do this on this date. Not because I said so, or because there were protesters, or because of people who are emailing me, yelling at me all day long, but because of the doctors who said so. Anything else?
I'm just curious, did you see a change in the number of tests at the community health center with the introduction of the Walmart testing?
I believe, I think the last few days we've seen a little bit of a decline overall in testing demand at some of our traditional testing sites. Mind you, we'll probably see the triage site testing going up because we have independent living facilities going there now as part of our new strategy. And certainly we have Nescentia Health going into assisted living facilities and doing the tests there. So we'll see testing picking up over the next week with our numbers. We'll be monitoring Kraus, Joe's, Upstate, and understanding what's going on at the triage site, because those are traditional sources for testing based off of CDC guidelines. Walmart, the Nescentia program, and then some of the triage site is all proactive strategy for the most part. So we'll be monitoring the data from where it's coming from and getting a better grip on what that data means. Okay, so Wednesday, that is 2 days from now, April 22nd, 2 to 6, Destiny USA parking lot near the Sky Bridge. The American Dairy Association, the Northeast and Dairy Farmers of America are going to be making a very large donation of milk. I want to thank them. It's incredible. Our farmers are getting hurt really bad in this process. They have extra milk. They're going to be there for people to come and get fantastic upstate New York milk. Please take advantage of that. Again, thank you to the American Dairy Association Northeast and our Dairy Farmers of America for this donation. I also want to thank all our volunteers who are going to help make this possible. These folks are going to be giving the distribution of milk to everybody who comes. The United Way. Our county legislators are going to actually be out there. That's good. Got to keep you guys busy. County employees and city employees, certainly Destiny USA, United Rental, and the Syracuse Police Department, Mayor's Office. Thank you all for taking part of this fantastic community effort. So, saying that, let's continue to be smart, let's stay strong, and be safe.